What are the different ways of managing endometriomas? When it comes to endometriomas, there are different ways of managing them. Drainage and washout is the simplest thing that can be done. It does not affect the ovarian reserve, it does not damage the ovarian tissue, but very quickly after the operation, they will just come back. So, except for in certain situations, very rare situations, there's no point in doing that. Then we have ablation of the endometrioma, and that can come in different ways, plasma jet or helica ablation of the inside of the endometrioma. Whilst for endometriosis in other parts of the body and the pelvis, in my opinion, ablation is an incomplete treatment and is not the right thing to do. For endometriomas, sometimes that is the right thing to do. And again, it depends on the circumstances, on the ovarian reserve, on the wish of the patient, more importantly. But sometimes it's appropriate to ablate the inside of the ovarian cyst. And what that means is applying a particular type of heat, for example, in terms of, in the case of plasma jet, it's an argon beam that treats those abnormal cells, evaporates some of those cells. So that's ablation of endometrioma. Then we have excision of the endometrioma, and that basically is peeling off the inside of the ovarian cyst and cutting it away. And that has been shown to be the most effective way in terms of pain and recurrence, and in some studies even in terms of fertility. But the downside of this is also the technique that has the most detrimental effect on the rest of the ovary, on the ovarian reserve. And that's where the problem lies. Then we have alcohol sclerotherapy, which is a technique that we have been using in the last year, and it seems to be very promising, which I will cover in a separate video. But that basically means putting some 96% ethylic alcohol inside the ovarian cyst, inside the endometrioma, leaving it for 15 minutes and let the alcohol do the job of destroying the abnormal tissue while, to some extent at least, protecting the normal ovarian tissue.